Now I'm delighted to be joined by this year's President for Medicine and Science, Dr. Ruth Weinstock. Thank you so much for being here.
Thanks, it's great to be here.
You've really pushed the use of telehealth over the years, something that's been a major focus during COVID-19. So what challenges did you face, and what advice were you able to give to others engaging with telehealth, maybe for the first time?
Yes, we've been using telemedicine for over 20 years to increase access to care and the quality of care, including to Medicare beneficiaries living in underserved rural areas, residents of correctional facilities, children with type 1 diabetes in their schools, and residents of long-term care facilities. But most of this work was limited due to lack of reimbursement from insurers. But with the onset of the pandemic, reimbursement became available, which enabled a rapid, widespread adoption of telemedicine and remote monitoring. It is critical that this reimbursement continue. Remote visits can increase access for medical care, as well as diabetes education and support, and the use of newer technologies, including increased use of CGM and remote monitoring, especially for people treated with insulin, and can improve outcomes. We need to continue this momentum and be able to increase the use of technology to improve access and outcomes. When adopting to telehealth, the first must is attitude. We must all embrace change, express our enthusiasm for the potential benefits while acknowledging and addressing the challenges. Work out with providers, staff, and the people we serve with diabetes, new workflows, and new expectations, and frequently assess what is working and what needs to be changed so that the telehealth visits work best for all. And as more in-person visits become possible again, we need to critically examine how best to care for people with diabetes, which I believe should be a hybrid system, with the frequency of in-person and telehealth visits varying based on individual needs.
The COVID-19 pandemic brought to greater public attention pre-existing disparities in healthcare. What is the ADA doing about addressing some of those healthcare disparities?
Well, it starts with the ADA's Health Equity Bill of Rights, which lists 10 rights. And these include the right to access insulin and other medications affordably, as well as supplies, devices such as CGMs and other new advances, the right to healthy food, and the right not to face stigma or discrimination. ADA advocacy is working hard to influence state and federal legislation that support the ADA Health Equity Bill of Rights. As examples, ADA engaged in over 350 pieces of state legislation, including capping insulin costs, and has been advocating for increased federal spending for research and other diabetes programs. ADA's initiative, Health Equity Now, has raised money to initiate exciting new programs, which are addressing disparities in minority, low-income, underserved communities. And ADA is funding new research grants that have as their goals to find and test new and better strategies and innovative approaches to reduce health disparities and improve health outcomes. 3 types of research grants will be awarded: postdoctoral fellowships, junior faculty development awards, and Health Disparities Innovative Clinical or Translational Science Awards, focused on supporting projects addressing the impact of diabetes on health disparities and the impact of health disparities on diabetes and its complications.
Diabetes is most common in older adults. You've expressed some concern that this group requires more attention. What's needed to improve the care of this large group?
Older adults are a heterogeneous group, spanning healthy working individuals to frail older adults who require daily assistance, either at home or in a long-term care facility. We need patient-centered healthcare delivery models that meet all of the diabetes needs as they age. For example, older adults taking insulin and insulin secretagogues are at high risk for having hypoglycemia and hypoglycemia unawareness, which can have devastating consequences, particularly in this age group where falls, hip fractures, and cardiovascular disease are so prevalent. To improve their safety and well-being, they need to be able to access appropriate medications, supplies, and devices, including CGMs, to detect hypoglycemia. And they and their caregivers need the necessary training so they can optimally use devices to avoid hypoglycemia. Better access to remote telemedicine services and remote monitoring is needed. Unfortunately, some older people with diabetes do not have a computer, tablet, or smartphone, and many do not have internet access and so are not able to participate in telemedicine visits or remote monitoring, which put them at a particular disadvantage during the pandemic. These services are not available in most long-term care facilities. It's crucial to make the internet accessible to all people with diabetes and examine new healthcare delivery approaches and use of new technologies that can better meet their needs and assist their caregivers with the goal of optimizing quality of life.
So tell me, what are the goals this year as president of the American Diabetes Association?
I believe in the mission of the American Diabetes Association, and am committed to work to accelerate change to fulfill our mission, which is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. My goal is to wholeheartedly support this mission. The first part of the mission is to prevent and cure diabetes. For this, we are strongly advocating for more federal research funding and working to raise more money to support the ADA's research program. ADA is funding innovative research in critical targeted areas and supporting new and junior investigators. This is critical as we need to ensure that we are training researchers for the future. The second part of the mission is to improve the lives of all people affected by diabetes. I am and will continue to be a strong advocate for diabetes medications, supplies, and devices to be affordable and available for all who need them, and to be more easily prescribed, advocate for expanded use of technology to help people with diabetes, and work to support ADA's efforts to reduce healthcare disparities. I also want to highlight the needs of older adults with diabetes. Their diabetes care needs change as they age, and we need to better meet these needs to improve their care and safety.
Thanks so much for being here, and best of luck for the meeting.